So another kind of biomedical psychotropic medication treatment is anti-anxiety medications, and this will go over page 577. So anti-anxiety medications are medications prescribed to help people deal with the problems and symptoms associated with pathological anxiety. So remember, this anxiety can actually be very debilitating and interfere with a person's actual ability to eat, sleep, just function in day-to-day life. So these medications can help with that. So the best known anti-anxiety drugs are the benzodiazepines, which include trade name drugs like Valium and Xanax. What these medications do is actually calm the jittery feelings, relax the muscles, and promote sleep. Now, they used to go by the name tranquilizers because they have that tranquilizing effect. So benzodiazepines produce their effects by increasing the levels of GABA, and that's one of those neurotransmitters. And GABA inhibits the transmission of nerve impulses. So by increasing the amount of GABA, they're limiting that amount of the nerve impulses that are telling the brain to be anxious or whatever, and all of that slows brain activity. So these are usually taken for a week or two and in therapeutic doses. They're not long-term medications. These are more of you take them as you need them type medications. These are actually considered to be the most effective medications for anxiety. And as I said, they work in the moment, which is part of why they're so beneficial. So obviously we have to talk about the side effects. So they can actually have some potentially dangerous side effects. They can actually reduce things like coordination, alertness, and reaction time. It is not uncommon for people who take these to perhaps even get so tired they just decide, I have to go take a nap, and they go lay down. Valium definitely has that effect on a lot of people where they will end up taking, they call them Valium naps. These effects can all be intensified if they're combined with alcohol or some other drugs. And one of the most severe reactions actually comes from over-the-counter antihistamines. So antihistamines are things, for example, like Benadryl. This combination can actually produce severe drug intoxication or even death. So another issue that people have with the benzodiazepines is that they can actually become physically addictive. In other words, it's not just that your mind says you need them, your body starts to need them. This is why some people will readily abuse, for example, Xanax is something that people will abuse, and it's a commonly abused psychotropic medication. So because of their addictive potential, benzodiazepines are less widely prescribed today, but they're still considered to be the most effective because they work as soon as you take it. As long as it takes for your body to absorb that pill, that's when it takes effect. So for some people, as little as 20 minutes later, they're feeling fine. They no longer have their anxiety. So it makes them one of the best medications for it, but the fact that they can become so addictive means that they're less widely prescribed. So one of the anti-anxiety drugs, and it's named Buspar, has fewer side effects. So because of that, it's actually becoming very widely used. It's not a benzodiazepine. It doesn't impact GABA at all, that neurotransmitter. They don't really know exactly how Buspar works, but they believe that it impacts dopamine and serotonin levels. Buspar can relieve anxiety while allowing that person to maintain normal alertness. They don't get drowsy. They don't have the cognitive impairments. They can still think clearly. So all those issues that people have with the benzodiazepines, they don't have with something like Buspar. Another benefit is Buspar has actually got a low risk of dependency or physical addiction. There's one major drawback though. You have to take it for 2 to 3 weeks before anxiety is reduced. So this actually decreases its effectiveness for treating acute anxiety. So anxiety in the moment, someone would have to be taking this long term to have any effect, whereas someone could take a Xanax or a Valium and feel relief within 20 minutes. This can take weeks. So Another new medication that's been explored in treatment for anxiety disorders and post-traumatic stress disorder is MDMA. And I always stumble over pronouncing this, methylenedioxymethamphetamine. So they call it ecstasy when it's used as a recreation drug. They've actually figured out that a few doses of MDMA, when it's prescribed and monitored by a physician, can actually improve the outcomes for people who are already undergoing psychotherapy for things like anxiety or PTSD. Now, use of MDMA can actually lead to some dangerous and unpleasant side effects, and it has high potential for abuse. It's usually only taken a few times. It's a very highly controlled substance. Um, and it's something that they've discovered can have an impact and actually help people with, especially I've heard of it a lot with people with very severe PTSD. Side note that is discussed in the antidepressant chapter, but I want to bring it up here because we're talking about anti-anxiety. There are several antidepressants that can actually be used as anti-anxiety medications. And when we talk about the antidepressants, we'll go into more detail, but it's used a lot, especially if people are having issues of depression and anxiety. They may turn to something like an SSRI. For example, Zoloft is extremely commonly used in people who have both anxiety and depression. Zoloft is a huge one. For some people, they might have a combination of medications that are considered to be antidepressants. It's not uncommon for people with PTSD to be prescribed like Paxil and Wellbutrin together. So a combination of antidepressants. So a key thing here with all of these is sometimes they're used what they call off-label. So it's not exactly what its use is, but they've discovered it works for other psychological issues. And so that's the case with some of the anti-anxiety medications or some of the antidepressants into anti-anxiety.